Hello and Assalamu alaikum. Ultrascan Diagnostics here. This is the CBCT of the patient that you had requested. The area of interest is all wisdom teeth. This is the panoramic view. You can see that the lower wisdom teeth are completely impacted, whereas the upper wisdom teeth are partially erupted and does not seem to be completely impacted. We're going to focus on the lower right wisdom tooth first. So this is the lower right wisdom tooth. As you can see, it is placed buccal to the inferior alveolar nerve. It is marked in orange. This tooth does not have any cystic lesions around it. It's completely impacted with the root completely developed and the apex closed. This tooth is compressing the inferior alveolar nerve canal quite significantly, as you can see right here, and this compression can result in damage to the nerve when this tooth will be extracted. So this is the inferior alveolar nerve. As you can see, it is being compressed by the wisdom tooth on the lower right hand side, all the way from the mid root level to the apex, and this is quite significantly associated, and there is quite significant compression of the inferior alveolar nerve canal by this wisdom tooth. Now moving to the lower left wisdom tooth. The lower left wisdom tooth is horizontally impacted, and here you can see there's no cystic lesion associated with this tooth. We do see, my apologies, we do see a radiolucency on the superficial aspect, but this radiolucency is not completely unilocular, or is not a complete oval shape, so hence we can't call it a cystic lesion. Here also we can see that the inferior alveolar nerve is underneath or inferior to the lower left wisdom tooth, and you can also see that there is compression of the inferior alveolar nerve by the wisdom tooth on the lower left hand aspect. Now this wisdom tooth shows us, and you can see that the inferior alveolar nerve is quite significantly being compressed by the lower left wisdom tooth. And throughout the duration of the lower left wisdom tooth, this tooth is very closely associated and compressing the inferior alveolar nerve on the lower left hand aspect. Now looking at the upper left wisdom tooth, the upper left wisdom tooth does not have any cystic lesions. It is partially erupted. We've got a very slight bone present on the buccal and the lingual aspects. You can also see that the tooth is not entering into the sinus, and the sinus lining is complete, but we do see sinusitis, quite significant sinusitis associated with the upper left wisdom tooth and the upper left maxillary sinus. Moving to the upper right maxillary sinus, we've got again significant sinusitis. There is no cystic lesions, no radiolucencies. It's not invading the maxillary sinus, but we do see sinusitis here as well. We've got this one is more erupted than the one on the left side, and the roots seem to be fused, and we don't see any anatomical variations in the upper right wisdom tooth. So if there are any further questions, please feel free to reach to our team. Thank you very much.